Yes, it was exactly the same. And there was never any damage, or there was never any like super destructive driving or anything like that. It was existing someplace I wasn't supposed to exist. And I figured I was dancing a fine line of was it wrong, in the sense that everyone whose cars I took, I engaged with in some way, and they were usually inebriated. So in the back of my head, I felt like for some reason I got pulled over or busted for this. I would have a very logical explanation. I have the guy's keys. He gave them to me. I don't understand what the problem is. Over time, I realized that doing that required a very specific set of circumstances, required interacting with people to get the keys, and it was too much work. I just wanted to be able to get my hit, so to speak, without having to go through, without having to go to a party, without having to time it. It was a lot more work. It wasn't a moral choice. It was a selfish choice. I remember thinking, my luck will run out. If I continue to do this, if I escalate, I will end up in jail, and I don't want to go to jail. There are other things that I want to do. I always felt very much as if I was floating in outer space. It was just this abyss, and I didn't know how far my lack of emotion would take me. And also because I saw sociopathy associated with monsters, there was a long time where I remember thinking, so is this just what happens? Like, I don't feel like a monster, but am I going to wake up one day and suddenly want to kill people? It was scary. I was really relieved when I got the diagnosis, which is not something I think a neurotypical person would experience. But when I've spoken to others like me recently, I found that with them, it was the same. I was relieved to get this diagnosis. I was relieved to see myself in your story, because I've always felt that there was something off, and now I had a name for it. And I also knew that I wasn't alone. There were at least enough people out there like me to justify a psychological disorder. Towards maybe the end of college, I had a conversation with my dad where I came very clean about the way that I was not feeling and the things that I was doing. And it was his suggestion that I see a therapist who did a clinical assessment on me, and then I was given the PCL. And that the score of that PCL is what determined the actual diagnosis. The PCL is the psychopathic checklist revised. It's the gold standard testing for psychopathy. The DSM is the Diagnostic and Statistical Manual of Mental Disorders. It's the psychological Bible, so to speak. It's what clinicians use for most diagnoses, and it's what insurance companies use in terms of coding and how to pay for the treatment. In order to diagnose someone with antisocial personality disorder, you use the DSM. And this is someone whose behavior is the huge driving force. You're going to see a lot of impulse control issues. They don't really respond to punishment or correction at all. It's the same behavior over and over again. In order to diagnose someone as a sociopath or a psychopath, you cannot use the DSM. For that, you have to use the PCL. So although these disorders have a tremendous amount of overlap and are roughly the same, they're different in that they require different measures for diagnosis. If something is in the DSM, that means it doesn't exist. When that's not true, there are many disorders that aren't in the DSM because they need a more complex measure to test. I'm pretty sure sex addiction isn't in the DSM. Looking at the behavioral markers for sociopathy and thinking, who says all sociopaths act like this? Who says that you're saying that all sociopaths are irresponsible, all sociopaths demonstrate criminal versatility, all sociopaths are incapable of impulse control? Well, I'm capable of impulse control, and I'm sure that I'm not alone. I'm capable of being responsible. I demonstrate criminal versatility, but you don't know that. I'm telling you that. If you don't have proof of it, how would you know? And so I was coming to it from a space of, we should be talking more about what's going on psychologically, and we should be spending less time talking about behavior, because not every person who has this personality disorder is acting in the exact same way. In order to sit for the PCL, it is a requirement to have a criminal record. And what that says to me is you're making a generalized statement about this group. If you are only testing people who have a criminal record, you're going to miss all of those who are sitting on the mild to moderate side of the spectrum who do not have a criminal record, myself included. Now, there is a different version of the PCL called the PCL-SV, which is given to those who do not have criminal records. But the fact that there are two different versions of the same test, I feel, is potentially problematic. And if you're only testing within the prison system, for the most part, your results are going to be far more conservative. My therapist's primary goal was getting the behavior under control and figuring out better coping mechanisms to deal with what we ultimately understood was anxiety related to this pressure that I was feeling. So we approached it that way, like, let's treat the anxiety, and that's what she did, and it seemed to be really effective. But for me, understanding the motivation behind my behavior was secondary to stopping the behavior. So at the time that I was in therapy, at first, I was engaging in a lot of destructive behavior, and that needed to stop in order for me to start learning about my motivations and develop new, more positive coping mechanisms, which is what we did, my therapist and me. In my experience, a combination of cognitive behavioral therapy, which is behavioral based, and talk therapy was really effective. But it was sort of trial and error. There was no standard treatment plan. There is still no standard treatment plan, which is wild when you consider that sociopathy affects roughly the same number of people who suffer from depressive and borderline personality and bipolar disorders. I did a lot of cognitive journaling, which is basically you write a thought you're having and then you write a counter thought. So it sort of forces you to take a look at any irrational belief systems you have. And I had an irrational belief system that if I don't act out, my compulsion to act out will grow stronger and it will overpower me. So it was, if I don't act out, I might be overcome by a compulsion to act out very destructively. And the counter thought is, if I don't act out, I might be uncomfortable, but I can process this differently. And that ended up being the more accurate construct like taking place. And once I understood, no, actually that's not the case, it made me feel better, and it made my destructive urges so much easier to control. It was, okay, so you're normalizing what's going on with me. You're not normalizing the behavior, and that's something I want to be really clear on. At no point do I ever want to romanticize sociopathy or normalize the destructive behavior that so many people with sociopathy engage in. What I do want to normalize is the psychological, the lack of emotional affect, and that felt really good to have somebody say, the way you feel or don't feel is very normal for someone like you.